everybody, it's Kika, your lifestyle blogger, and I am back to talk more about senior living, healthcare, and all that in between. So, I wanted to talk to you today about home health. This subject is near and dear to my heart because I work in home and community based services as a sales manager. And I manage a group of account executives that ensure that you have the information needed to make that next journey in your life as far as your health is concerned. So, I want to make sure that you are equipped with this information, and this is especially if you are following me on YouTube and if you have subscribed to my channel. This is the information that you will want to hear. Now, rather you're the client yourself or you're a family member of a client that needs home health services, I want to tell you a little bit more about home health and how this can impact your life. The last two videos we discussed senior living and making the move to senior living. Well, there's another piece to that puzzle, and that is home health care. A lot of seniors do not realize that after you've made that move into a senior living community, there may be situations that arise where you need to activate home health care. They're thinking, well, I'm living in a community. There's nurses here. There's nurses assistants here. They can help me. All they need to do is just charge me a little bit more. Roundabout way, yes, that would be true. However, here's a way that you can save money because you've worked all your life and you deserve it. So, there is a Medicare benefit, and in that Medicare benefit, Homebound. And what Homebound means is if it's a taxing effort for you to get up, get dressed, go to the store, go to work, take care of certain things, and it's probably best for you to have someone with you, then I would say you would be qualified as homebound. Now, homebound does not mean you're at home all the time. You can go out and get your hair done, you can go to church, you can get your nails done, and all of that stuff. However, homebound simply means it is a little harder for you than normal to go out and do those normal things that you always did. So, that's what homebound means. And under that benefit, Medicare pays for your home health service at 100%. That doesn't mean that you have to live in your own home to have that benefit. It simply means wherever home is, whether it's an assisted living, group home, your own home, or living with your children or a roommate, it doesn't matter. You deserve that benefit because you paid into that benefit and you're entitled to it. So that's your entitlement. And Medicare will pay for home health services for you 100% if you are homebound. Now, something I want you to know for those that are living in senior living, it's really important that you listen to me very closely. If you are not activating home health when you're living in senior living and you elect to utilize their services there on campus to go down and have your exercise program, physical therapy, occupational therapy, what that means is they have an occupational therapy or physical therapist on site, and they have a therapy gym that you can come down from your apartment and go down to the gym. In a roundabout way, that sounds beautiful, doesn't it? Because you can get up, go down, the gym is there, you can rehab and get all ready, and it's right here in the comfort of your own home. Yes, but that's going to cost you. That particular therapy is an outpatient therapy. Even though it's inside of the community where you live, it's still considered outpatient. So that is activated under Medicare Part B, and there is a copay associated with that. So I just wanted to let you know, it is something that you can do, and if you feel like you can get up, get dressed, and get ready and go down, when your time is allotted for you to go down and have that therapy service, definitely activate that one. However, if it's a little hard for you to get up and go down and get dressed and make sure that you're down there on time for whatever reason, then homebound status may be the way to go because those same therapists can come up to your apartment and do those things with you. So you won't go down to the gym to do physical therapy or occupational therapy, but they will come to you in your apartment and do those services. And again, it's paid at 100% through Medicare. That's your Medicare benefit. Now, the only other additional thing is that particular service goes through home health. So your home health agency is partnering with the therapist to bring you that service. But all the same, it still works out very well. We are all in it together. We are working for you and making sure that you rehab 100% to keep you out of the hospital, because we know that is the goal. All right, on to tip 2. You're living in a senior living and you have maybe, let's say hypothetically, you had a fall and you needed to go to the hospital, and then you're kind of debating, I want to go back to my senior living. They have nurses there, they have CNAs there, they have people that'll take care of me. Why do I have to go to a skilled nursing and share a room with someone? I don't want that. I want to go home, home, home. We hear this all the time, and I totally understand. I'm with you. I get it. I'd be the same way. However, what I want you to think about is your health. That is so important and so key in what I'm talking about today. We want to make sure that you are healthy and that you stay out of the hospital. And the only way to do that is to go through the different channels to make sure that you are getting the right therapy at the right time and you're doing those exercises in the right way. There are a lot of people that bypass all of that and they go home, either to an assisted living or to their own home. And they say, you know what? I'm out of the hospital now. I'm back home. I'm feeling much better. So I don't need home health. But then you don't realize how much you do need no home health, because there are things that can happen that'll land you right back in the hospital. And that's putting everyone at risk. And when I say everyone at risk, there's a couple of things that I mean by that. Hospitals cannot keep having people come in for the same thing over and over, because that's saying that they did not do their job. So they have to make sure that they have a nice discharge plan for you. And a part of that discharge plan is ensuring that you have the services that's needed when you go home. And in a lot of cases, that's going to be home health. So let's talk a little bit about what home health looks like in your home. Keep watching. Okay, guys, I'm back. So let's get into this and talk a little bit more about what home health looks like at home. But first and foremost, it is important for you to know there is a bit of a difference in the terms. So the term home health is utilizing the healthcare portion, which is like PT, OT, and skilled nursing. That is home health. Home care is utilizing more of the care portion, where you have maybe a certified nursing assistant come in, or maybe a PCA, something like that. That's home care. And usually home care is paid for out of pocket. So you will pay for home care benefits out of pocket. Home care benefits because they need a home health aide to help cook your meals, clean, maybe help you in the shower or not, but that is home care. So that takes out the medical portion and someone just to merely be a personal assistant to you. That's what home care is, and that is paid for with your own money. Okay? So home health is one thing and home care is another. Home health is paid for by insurance. Home care is paid for out of your own pocket. All right, let's move on and talk a little bit more about what home health care looks like in your home. Now, there's two things I want you to really keep in mind. We are in a business to serve our customers, clients like yourself that are looking for home health care. And that is very, very important for you to know. But it is a business. So we want to make sure that we're doing things right, because we are governed by certain laws and regulations, and that is very key and very important. In addition to that, the other important thing is that We function on your referrals. So when a discharge planner, a social worker, a nurse, or anyone for that matter in the healthcare field sends over a referral, that is what we're looking for. That's what keeps us in business. That's what keeps us going. That's what keeps us advocating for you. So your referral is key. But we have to make money, and that is important. It's imperative that we do that so we can keep on going. And the way we do that is through referrals. Now, there are a few things that you need to know. And I don't want you to get too hung up and confused by this, but it is very important because there are some new innovative things that are happening out there that you just need to be simply aware of. So the first thing is there's a new service that people are doing in home health, and it's called Therapy at Home. Now, as I explained, there's a partnership that comes in with home health and therapy service. And the therapy service is sometimes a standalone. Sometimes there are assisted livings that have an outpatient therapy gym in their community where they have partnered with on their own a therapy service and to bring you this service. And I know to you it looks like it's just the staff from the assisted living community, but it's actually two different caregiver teams working together to provide that wonderful service to you. So that is the way that they do it. In addition to having that therapy service and working on an outpatient, a lot of times outpatient doesn't work for everyone. And being at home is where people really want to be just for safety measures, especially when COVID came around. Safety measures was very important. So even though a person probably is healthy enough to go out and about, it just wasn't safe to do so because of COVID and all the stuff that's happening. Now we are seeing a glimpse in a little bit here and there of COVID still happening in various communities. But with that being said, I just want you to be aware of one thing. There is an elective service where you can do therapy at home. And I'm not too sure of the lingo, what they call it, but it is a therapy service that's brought to your home. But it's an outpatient therapy service that's brought to your home. So you're actually having outpatient therapy at home. A lot of people will mistake this service for being homebound. Please understand it's not one and the same. The outpatient therapy service that they're providing to you at your own home does come with a cost. You are charged a copay for that outpatient therapy that is going to come to your home. So make sure you understand the difference and that you ask the question, is this saying that I am homebound? Or is this simply an outpatient therapy that's coming to my home? That's going to differentiate whether you have a copay or not. If you are living in an assisted living community, a lot of times you need to ask the question, do you have therapy service here in the assisted living? And if they do, more than likely they want you to use their therapy service and not have an outside service come in. A lot of places are going that way for whatever reason. They are doing this. They have their own partnership and their own setup. So you need to be aware of that as well. And so make sure you ask that question because there are a couple things that can happen that would cost you some money. And let me explain that. So if you elect that you wanted to use a specific therapy service and have them come into the assisted living to take care of you, or going through home health to come in and bring that therapy service in to take care of you, and the assisted living that you live at already has a therapy service and they're not partnered with the home care or home health agency that you chose, the problem with that is you may be charged a fee. And it may be, I don't know what the fee is. Various places differentiate their fees. Some could be as low as $50 and some could be as high as $1,000. I just don't know, and I can't give you that answer. So please don't take this as me giving you an answer of what that price is. You have to do your research and find out what that cost is. So if you're living in an assisted living community, I'll say it again. If you're living in an assisted living community and they have therapy on site, but you elect to use a home health service outside of their organization and have them come in and take care of you, it may cost you. So you need to find that out and ask what that cost may be. So that's just a disclaimer. I wanted to put that information out there because, of course, I am here to help you. There's another important thing that you should know, and that is if you go to the hospital, and I know that you want to go back home, but remember what I said, that can put a lot of people at risk if you're not following the proper discharge plan. And what I mean by that, as I explained before, hospitals will get in trouble if you keep coming back in for the same thing. So we want to make sure your discharge plan is seamless and the care coordination is perfect. And a lot of times hospitals do partner with not only your physician, but with a home health agency to ensure that you are successful when you go home. If home is in an assisted living community, it is extremely important that you know that that assisted living community is responsible for your care. So, with that being said, you want to make sure that you are discharging with the right care plan and that it works seamlessly with the assisted living that you live at. Okay, guys, that is it for today. I hope the information that I shared was very helpful to you. In no way, little bit of a disclaimer, am I putting down any agency. I love to partner with every agency out there to bring you the best care possible. That's care coordination, and that is very important. My name is Kika, your lifestyle blogger. And feel free to leave a comment in the box below if you have any questions. Reach out to me.